Hey guys, if you're new here, my name is Yassine Badr. I'm a medical student studying medicine in Egypt and want to practice medicine in the United States. So let's get right into the video. So in order to study as a doctor, you need to know what the job of a doctor is. A doctor's job is basically to do three things. The first thing is to figure out what's wrong. What's wrong with the patient? Why is the patient coming with dyspnea? Why is the patient has tachycardia? Why is the patient has chest pain? Figuring out stuff, diagnosing illnesses. This is the first job of a doctor. The second job is basically to manage, to do something about it. Not only watch or figure out, oh, this guy has myocardial infarction. I have to know what to do in the case of a myocardial infarction. So this is the second job of a doctor. The third job is to teach the patient about their illnesses. These are the three main jobs or parts of the job of a doctor. So having this in mind, let's talk about how does a doctor study in order to achieve these three goals. A doctor doesn't just read the book and hopes that he remembers stuff like medical students do. A doctor cares more about how is he going to use this piece of information. How is he going to apply this piece of information in his clinical practice? Not just remember it, he has to apply each and every piece of information he reads. Let's take an example. If you opened any textbook of pathology and you want to learn about what is the most common people to get endometrial cancer, for example, right? You'll find that old females are very common to get the endometrial cancer. And as a medical student, all you could do is basically to memorize this fact. Oh, endometrial cancer is very common among old females, and that's it. And you try to memorize and put this piece of information into Anki flashcards and try to repeat it over and over again until it sticks. But the doctor takes it a bit further, a step further, which is how am I going to apply this piece of information in clinical practice? How could I possibly apply this? And you should do this with everything you read. You shouldn't just read the book. You should try to think, how am I going to use this piece of information? And I have a reason for this, okay? A very important reason of why every medical student should study like a doctor. Because basically your brain doesn't like pieces of information hanging around without any purpose. Your brain will work on deleting information that you will not use, okay? So it's very useful to teach your brain, to tell your brain, okay, I am going to use this piece of information this way. So it helps you to keep it in your memory as much as possible or as long as possible. So this is very important, guys. You shouldn't just read the book or memorize stuff. You should take it a step further, and this is necessary. This is how you study like a doctor. You should learn, oh, I am going to use this piece of information this way. And this example I gave you guys here, the most common people to get endometrial cancer are old females. How am I going to use this piece of information? Could you possibly think? A doctor will say, okay, so when I have an old female coming in with bleeding, the first thing I'm going to think about is cancer, because I know it is very common in patients in old females. This is how am I going to use this piece of information. When I have an old female, I will think about endometrial cancer. So it helped me figure out what's wrong with the patient. Did you get that? I hope you got that. So you should think about each and every piece of information you're studying and put them into these three categories. First one is figuring out what's wrong with the patient. Secondly is managing or doing something about the patient. Thirdly is teaching the patient something about his disease. So what is the best way to easily do this? Are you going to just think about every single piece of information? Is this possible? No, it is not realistic, and it's very hard to do it. Yet it's very helpful to do it. It helps you memorize stuff better. But there is an easier option, which is doing questions, questions, questions. Questions have this way of telling you, oh, use this information this way. They will get you an old female with bleeding, and you will have to think about, oh, what is the most common cause of bleeding in this woman? Whoa, it's cancer. So you start developing, oh, I'm going to use this information this way. You will have actual cases to deal with and to forcefully apply your knowledge, or you're not going to get the question right. So you will learn how to apply your knowledge by doing this, by doing questions and learning how in real life you're going to use certain pieces of information. And actually, this way of studying is the best way, and it's the way that high scorers, top USMLE scorers study every single day. It's questions, guys. I hope you enjoyed this video, and I hope you got a ton of value from it. And if you have any questions, send me on Facebook, Instagram, or just comment on the video, and just smash the like button if you like this video, because it helps with the algorithm, and subscribe. Don't forget to subscribe. Have a nice day, guys. Bye.